I'm the director for the Franciscan Cancer Program, and we had a very unique opportunity this past week in the fact that we collaborated with some future partners right near Oncology at QL, which is a first for us, and so we were really excited. This was our first foray into seeing how we could work together, and we did an awesome job, I think. And then we also were fortunate that we had a patient, and we had Mark Stever from the pharmacy and from St. Francis come and help us out, as well as Dora Woodward and Jenny Spokley from Northwest. So now Dr. Blau is going to be our Vanna White here. I'll talk, she's going to guide you. So first of all, in this corner, just disregard this. This is a stairwell that we had to make room for and work around. But we're at the far end of the building. Mount Rainier is at that end of the building. There's a little picture of Mount Rainier, so just to give you some context of, I believe we're overlooking the freeway. So the patients are going to come off the elevator here, come down the hallway. They'll enter our suite right here, and they'll have their intake done downstairs. So just like everybody else, the intake will happen downstairs. They'll come upstairs. We do have a few areas for patients because they're oftentimes neutropenic, meaning they have a very low white count. They're very prone to infection. Dr. Blau did have to do some intense negotiating with Steve, the architect, because we originally wanted 6 to 8 chairs. Steve said no, no, no. So we're lucky to have 4. We also, one of the things that Betty pointed out as a patient is she's had quite a bit of exposure and experience with Fred Hutchinson and the Salem Cancer Care Alliance as a patient in that system as well. And what we have here is a sick area. We'll call it something different, but it's an area for patients that might have a cough or might not quite be feeling well enough to, even if our rooms are full and they've come up early or they're just not feeling well, that they can be in a place where they can cough and just kind of be out of the general area while we're waiting to room them. So we have a little sick room. We ended up having to move our restroom in the corner here because working with therapy services, and they'll go over their unique situation. We actually ended up flipping spaces with them through this process, and so we curved our wall to help support some of their intake issues. So we then moved our resource center over, and our resource center's gotten a little bit bigger because Dr. Blau wants to do some lymphedema and some palliative medicine, and yes, quite creative on some of the things that programming we want to offer there. So, and then some general information for patients and families. So coming down the left side here, the patients will enter into one of the 6 exam rooms. One of the things that Dr. Blau also pointed out was the fact that we should have a room that was a little bit bigger, one of our exam rooms, because of bariatric care in the wheelchairs, and oftentimes our patients come up with them, so we've taken that into account. We borrowed from family medicine the barn door concept. That's really new for us and stepping out of the box, and we're a little nervous, but we built that into our concept. So then there'll be a door at the back there between the doctor's office into infusion in case patients go that way to get infusion. Most likely the patients, though, will be coming in this way and going around the right side up to the whole back of the building. Because of all the windows and the light, will be 12 infusion chairs. So that's what you see back there with the curtains. And then, of course, the nicest room, probably the largest room here, is for the pharmacy. Because of code, yes. It was only because of code. There was a lot of negotiating on that space between Dr. Blau and Mark on what his needs were, so it was all about Mark. So, and then we had built, very utility and, clean, and we have lots of restrooms because there was a lot of concern from the nursing side in regards to those patients. A lot of the medications they get create GI upset, so we wanted to make sure we had plenty of restrooms for the patients wherever they were and the staff, and that is the oncology space. Mixing, yes.